Good morning, everyone. This is Peggy Huppert. It's so weird staring at myself in a screen instead of standing in front of you all this morning. But I'm here to welcome you to our first ever virtual annual conference. I see that as of right now, we have 179, well, it's just 181 participants at this point. And I'm thrilled to tell you that we had an audacious goal of getting 1,000 people to join us today. And we may still reach that, but as of late yesterday, we had 826 registrants from 18 states and 2 other countries, Great Britain and India. So I think that's fabulous. I'm sorry that we all can't be together in person today, but I think it's wonderful that we're reaching so many, I'm assuming a lot of new people from so many different areas of our country and even the world. For those of you who aren't familiar with NAMI, National Alliance on Mental Illness, and I'm sure that some of you are not, we are the largest and oldest grassroots organization in the United States dealing with mental health issues and conditions. We have chapters in all 50 states, obviously including Iowa, and we have over 600 local affiliates. Here in Iowa, we have 15 local affiliates, and we serve thousands of people through our signature programs, education, advocacy, and outreach. Here in Iowa, we have 4 events a year that we're very proud of. The annual conference is one. We've grown this over the last 4 years. The very first one, we had 60 people, and last year we had 160, which is terrific. And now we have almost 1,000, so that's even better. Our next event coming up is our Day on the Hill, and that's going to be March 17th and 18th. We're doing a hybrid version of Day on the Hill this year. Education will all be virtual, online, on the 17th. And then on the 18th, we've reserved space in the Rotunda. We'll have tables. We're going to invite affiliates to come and talk about the work that they're doing and visit with legislators. We're going to invite our members to come and visit with legislators if they feel comfortable. We don't know where we're going to be with the virus at that point, but we'll also have some virtual ways of reaching out to legislators. And then our next event is Beautiful Minds, which many of you are familiar with. It's a unique event involving, we hire local actors to portray famous people from history who lived with serious mental illness. We have a big opening reception with all the actors, a partnership with Des Moines University, and they host it. And then people host dinners in their homes, and they each have an actor at their home for the evening portraying that person. And it really has sparked some wonderful dialogue, meaningful conversations, new friendships, as well as supporting the work of NAMI Iowa. And then finally, our last event of the year is the walk. And we just had our virtual walk on October 10th. I wasn't sure how it was going to go, but it was a smashing success. We had over 600 people participate, and we had a goal of raising $130,000, which I was not very sure we would get anywhere close to. And actually, as of this morning, we're at $129,129. So we're very close to our goal for our walk. So we have a staff of 7. They're going to be joining us throughout the day, taking on different roles. I just want to call out Zach Blevins, who is the logistical mastermind behind today. He's our events and outreach manager. And Nina Rickman, who is our program manager. She just waved to everybody. Hi, Nina. Nina really got well, she was responsible for the content. So we worked together to get speakers and establish what we wanted to cover. and Nina has done a fantastic job of that. And we're going to be introducing the rest of the staff as we go along today. I want to thank the sponsors, Johnson and Johnson, Janssen Pharmaceuticals, Mental Health Leader, and AmeriGroup, Mental Health Advocate. AmeriGroup is one of our managed care organizations here in Iowa for Medicaid. Be sure to explore our virtual site for the annual conference at namiiowa.org/annual conference. This is how you'll join each session throughout the day, and you can also find out more about today's speakers, our film festival, which is really cool. That's another new thing this year. We have 3 films that are available for your viewing related to mental health, and our annual membership meeting, which is tomorrow morning from 9 to 11, which you can register for there. We are recording the sessions. Videos will be uploaded and sent out on Monday. For Q&A, you can ask questions to our speakers. Put them in the Q&A box, and we will get to them as many as we can during the Q&A portion of each session. We do want your feedback. We have evaluations. A survey link will be sent out at the end of the conference. So please be watching for that and complete it as soon as possible while things are still fresh in your mind, because we really want to get your feedback and make things better. A film festival offers, as I said, 3 films. Bedlam, which I think many of you have seen. It was aired on public broadcasting in March originally. That's available through tomorrow, Saturday. Orchestrating Change, which is a new film documentary about a group of people with serious mental illness who form an orchestra. It's an inspirational film, and I think you're going to love it. And that's available through tomorrow as well. And then finally, Ernie and Joe, Crisis Cops. And there, of course, Ernie and Joe are our closing plenary speakers, which we're very excited about. And that film is available through Monday. And I'll just say a word about Ernie and Joe. It's an HBO-produced documentary. It's 90 minutes long, the full film. It's wonderful. You definitely want to see it. This afternoon, we're going to be sharing a 25-minute version of the film, which is not going to be available to the general public. It's only available for our session. So the one that's available through our link for everyone to watch who's registered is the full 90-minute version. So please stay connected with us after today. Follow us on social media. We have almost 7,000 followers on Facebook. We post at least once a day. And we'd love for people to follow us and participate in that. Finally, I want to point out an exciting contest that we're doing that I hope that you'll all participate in. If you are not already on our grassroots advocacy listserv, we have currently about 850 people on that across the state. We're looking to build that so that we can build our advocacy presence in the next legislature and for years to come. We have a new platform that we're using for that, and we need everyone's full address so that we know which legislative district they reside in. So we're trying to build up that list, and to that end, we're having a contest. Everyone who joins the list by December 15th is going to be entered in a drawing to win the Ultimate Advocate giveaway. And that's a prize package worth about $200 that includes an Amazon Fire tablet, a messenger bag, a mental health t-shirt, advocacy stickers, Casey's gift card, Scooter's gift card, and a clipboard for organizing. It's a pretty cool prize package, and you might be the lucky winner. So please join us. You need to be an Iowa resident and help us spread the word. And more details can be found on NAMI Iowa's website. So now it is my great pleasure to introduce our first speaker of the day. We couldn't ask for anyone better. Teri Brister is a friend. She is one of the top leaders of our national organization. Although you'll notice when she starts speaking that she is not from here, and she's not from Washington, D.C. She actually is from and lives in Mississippi. And she's been to Iowa many times, and it's usually really not very good weather. Which, by the way, Teri, it is today, not great. It's cloudy and in the 40s. So not as bad as it has been, but it's not great. It's probably not Mississippi standards. Teri has worked with us on several projects. Chief among them, one of which I know we're both very proud, is the collaboration with Des Moines University for Provider. And Teri has been working with us for 3 years on this. We're over 3 years, actually. And it has resulted in Des Moines University training almost 900 medical students in our provider program. It's now required for all third-year medical students at Des Moines University. We've worked with them to produce a new improved version of Provider that we think is going to resonate better, specifically with medical students. We've produced a video, which we're really excited about, which Teri has helped us with, and our national organization intends to use to market Provider to medical schools across the nation. Teri is in her role at our national organization on the cutting edge of research, making sure that our programs are evidence-based and continually updated to meet the needs of people with a serious mental health condition and their loved ones across the country. She's a former state director of NAMI, so she has that background. And so she gets the challenges that face state chapters and local affiliates, as well as having the national perspective. She's one of the key advisors to our new CEO, Dan Gillison. She got Dan to attend our board retreat in June, which we loved having that opportunity. And she's just a really, really terrific person and a wonderful representative of NAMI. So please help me in welcoming our first plenary speaker, Teri Brister.
Thank you so much, Peggy, and what a wonderful introduction. No pressure at all when I see the attendance rising steadily on the screen. You know, when you're in the room live and you see people coming in and out the door, it's not like watching the what feels like a Geiger counter going up at the bottom. So it's a pleasure to be here and with all of you. And I want to thank Peggy for the invitation, and Nina and Zach and the other NAMI staff for all that they've done to make today possible for all of you, and for the wonderful group of presenters that they've assembled for you. And it's a privilege to get to kick the day off. It's unusual, as Peggy mentioned. I feel almost like I should be eligible to apply for that advocacy toolkit, Peggy, because I feel like I should be a virtual, I almost have dual residency in Iowa with all the time I got to spend there with the DMU project, which was such a privilege. I realized putting the presentation together that my last NAMI trip was to Iowa for the provider training earlier this year. So that was interesting. But there are just so many good things that are going on in your state. And so many times you don't realize because you only see what happens where you are, but getting to see all of the things that are happening with the different NAMI organizations, there are such exciting things happening in Iowa. So typically where I was going is I've been to the NAMI state conference on several occasions before, typically talking about the NAMI provider program or NAMI education programs. So it was a bit of a challenge this year when Peggy asked me to talk about looking at NAMI 2020 and beyond, especially because 2020 has been such and this is a technical term, bizarro gear. I mean, it's like you think you've got your hands around it, and then it shape shifts. So what I've tried to do, and I hope you'll bear with me, is give you I'm not sharing my screen yet, so thank goodness you can't see all the things that are popping up. What I'm going to try to do is give you, from my perspective, what's going on at NAMI during 2020, what things are on the horizons for 2021, the best we can tell, the best we can predict. One of the things that I have stuck on a Post-it, and those of you who know me know I do love pieces of paper, but early on, and it wasn't early on in the pandemic, it was around the time school was getting ready to start back and parents were really stressing out. You know, do I send my kids to school? Do I not send my kids to school? What decision do I make? What's the right decision? And I saw an interview with a pediatrician that I thought was just phenomenal. And she said, the decision that you make about school is the right decision. That the biggest thing is making a decision on the information that you've got and then sticking with it and not continuing to stress over it. And I've really tried to think about that in terms of even what we do at NAMI. So I want you to bear that in mind as I talk to you about the things that we're planning for 2021. We've used the word pivot more this year and surreal more this year, I think, than any time in my life. And I've been around for a long time. So with that said, I'm going to screen share. I hope this is going to work. And let's do this. Let me move myself off. And Nina, if you'll let me know for sure that this is working.
It's working, Teri.
Yay. I love it when things work. All right. So I want to walk you through kind of where we've been. And there are some of you who may not be completely and totally familiar with NAMI. So for some of you, this is old hat. I promise you this is not going to be NAMI 101. But I did want to start out with who we are. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives, supported by a community that cares. Pretty plain vanilla. We just want to be people who live our life the best that we can. We see our mission as providing the advocacy, education, support, and public awareness necessary so that all people affected by mental illness can build better lives. And we do have this it's not really a three-level structure. Saying it's a three-level structure implies there's a hierarchy, and there's really not. We have the national office, which is based in Arlington, the state organizations, as Peggy mentioned, and we have over 600 affiliates or chapters across the country. But we're really not a top-up or bottom-down organization. We very much work from side to side and horizontally. NAMI does have a strategic plan, and we've always had one. We have a new one that ironically went into effect in 2020. Some of you may have been involved in it. Peggy, I'm not sure if you might have even been on one of the steering groups. There was about an 18-month process that was involved in developing this plan using a multitude of consultants. They did focus groups, they met with state executive directors, they met with affiliate leaders, they met with people on the Peer Leadership Council, the Service Member and Veterans Council, to really look at who did NAMI need to be? What did we need to be doing? Who did we need to be serving? What did our 5-year plan need to be? And it drilled down into what were our roles, what were our goals, and then what are the accelerators? What I really want you to look at is out to the far right, because that's the most important. What are our 3 big goals? What are our top priorities? And what I want you to hear also, I'm going to talk to you about our He Still Feels New CEO, Dan Gillison, in a few minutes. Every conversation that Dan is involved in, he refers to these 3 goals. Which of these goals does it involve? How does it impact it? People will get help early. We've known for years that the earlier we identify signs and symptoms and that we intervene in those symptoms, the better the outcomes. People have to get help early. They have to get the best possible care. The treatment services have to be out there. The providers have to know not just what they're doing technically, but what they're doing emotionally and what we need them to know, which is why what DMU is doing with the NAMI provider program is so innovative and so critical, and so many other medical schools can learn from them. And the third, people get diverted from the justice system involvement. We've seen way too many tragedies this year alone, above and beyond what we've seen in past years, on top of the pandemic, of people with mental illness who've died during law enforcement interventions unnecessarily. So off to the right, you see our three big goals. On the left, how we work together. We listen, we build our community, we educate, we support, we advocate, we lead the conversation. And then the things in the middle are the accelerators. We use technology, we partner, etc. So I wanted you to have an idea of kind of how we see this. This is a drill down. There's actually a document which I'm happy to share with people if you're interested in it. So again, the title of the session was Beyond 2020. 2020 and beyond, I believe, which does sound kind of Star Warsy, Peggy. We were having that conversation earlier about all the technology we're using these days. So you see a photo of our new CEO, Dan Gillison, and as Peggy said, she had asked me to present at the board retreat back in the summer and on the state of NAMI. And I said, you know, what about Dan? He would love to come. And he did. He was ecstatic to be there. He's phenomenal. And when I talk about him, I probably am going to sound like a car salesman, but I want you all to hear that I've been at NAMI for 15 years, and Dan is probably, and I've liked every CEO that's been here, Dan is probably the greatest leader we've ever had at NAMI in terms of being able to see the big picture. And it's been so inspirational. I feel more hopeful about NAMI than I've felt in a long time, and I mean that genuinely. So Dan started January 21st. February 7th, I went to NAMI, Iowa for the DMU provider training, my last trip. I traveled 65,000 miles in the air last year in 2019. I went to Iowa in 2020, so I think that's kind of fun. February 21st, NAMI, who's always been based in the Arlington, Virginia area, moved into a new office space. It was only a mile down the street, but it was a huge deal. Everybody was excited. New CEO, new office. March 20th was the last day anybody went to work in that headquarters because of the pandemic. The world changed. Everything had to shape shift then. We had to start learning how to do what we say again all too frequently. I've got to quit flipping pages and pay attention to what I'm doing. We had to start learning to pivot. When the office is closed, again, we've got Zoom. We can talk to each other virtually. That's not a big deal. A lot of things can happen virtually. But NAMI's high touch. We have a helpline that was brick and mortar. Our programs have almost all been done in person. We've been a high touch organization. So we had to stop and think about, what do we do? What does this look like? It took 2 weeks to get the technology set up for the helpline volunteers in the Arlington area to be able to take calls at their home, to get the call transferring set up so that, you know, again, it was a whole big deal. I don't understand the technology of it, but it took about 2 weeks to get it to work seamlessly. We were getting questions from the field simultaneously because all of you across the country were going through the same things. At different times, the shutdowns were happening. What we heard very clearly were two big questions, and we heard them in this order. The first question was, how do we keep doing programs? What do we do? Can we do programs virtually? How do we do it? Do you have suggestions? Do you have thoughts? Can you talk to us about this? Then second, and it wasn't immediately, it was a couple of weeks later, how do we keep our doors open? Oh my gosh, we have to cancel our walks. We have to cancel our galas. We have to cancel our fundraising activities. So what I want you to hear really clearly is what bubbled up is, and this is no surprise to most of you in the room, is NAMI was worried about taking care of the people we serve. And then it was like, oh my gosh, how are we going to pay the bills? Then it was worrying about that. So there was shape shifting that had to happen with the programs. We developed a resource guide almost immediately. As soon as the helpline call system got set up and volunteers were able to start responding to calls again, the helpline staff worked to develop a COVID-19 resource guide to try to start directing people where to go to find the answers they were looking for, because everybody was grappling. Nobody really knew. The follow-up to the quote I shared with you earlier about whatever decision you make is the right decision for your child going back to school, her follow-up quote was, "We don't know what the future holds, and to make the best decision implies that you know all the answers." And we still don't know all the answers. We're closer now than we were earlier in the year, but we're still not there. What we did know early on was that we needed some kind of a guide that we could direct people who were calling the helpline to, and our field leaders, so you guys could direct people to something. And that guide's phenomenal. I've got a link at the end of the slide deck if you haven't seen it already. Our education team put together a guide to how to offer programs virtually. We didn't have time to recreate the programs. So what they put together was kind of a step-by-step. If you're doing it via Zoom, you can do this and this and this. Here are some options you can try. Ken Duckworth, our chief medical officer, and I decided, you know what, we need to offer NAMI Ask the Expert now. We typically do that once a quarter. We decided we needed to start doing it more frequently. It turned into every other week for a while, and we're now doing it every other month. We decided we needed to get information out there for people. It was so well received that we actually had to move to 2 different platforms. We've ended up on WebEx. Our traditional audience for the Ask the Expert was 150 to 200 pre-2020. We now have an average of 1,500 people on those webinars. So it's the audience has grown tremendously. We started holding NAMI virtual town halls because what we realized was while we were holding the NAMI Ask the Expert, where we had somebody typically in the research space or the medical space or the treatment space talking to anybody, the general public, you know, whoever wanted to join the call could join the call. We realized we needed a unique space that was available for NAMI leaders, the executive directors, the program directors, the presidents, the members of the boards of directors, to talk about what do you need to know as you're trying to shapeshift your organization. So the field advancement team started holding a separate series of virtual town halls with topics focused on things that were, again, some of the topics could have been applicable for Ask the Expert, but they were tweaked in such a way that it was what do you need to know so you can apply it to your organization. And then ultimately the virtual NAMI convention, which none of us ever really thought was a possibility or was even something that we would have to consider as an option when the shutdown happened in March. We just, again, none of us ever saw that coming. And there was quite a lot of conversation, as I'm sure Peggy and the NAMI Iowa staff had about this state conference. Do we do it? Should we just cancel? The American Psychiatric Association had held their conference virtually and their platform crashed the first day. You know, we'd heard horror stories. But we decided to do it and put it out there and decided to do it for free, which we'd never done. And we had 25,000 plus register and more than 15,000 who attended. One of the things that became clear early on And Ken, Dr. Duckworth used the medical term, that the mental health tail on the COVID-19 pandemic was going to be very, very long. We were going to be feeling the mental health effects of the COVID-19 pandemic long into the future, way after the vaccine, way after, we get past some of the close downs and perhaps even, the mask wearing. It's going to continue. One of the good things, if you will, that's come out of it from my perspective, one of the silver linings is that it's made the world realize at the end of the day, we're all human beings and we're all vulnerable to stress. We're all vulnerable to pressure. We're all vulnerable to mental illnesses. We're all just human at the end of the day. One of the things that came out of the pandemic, a space we were not in at all, is in the space of frontline professionals, frontline public safety workers, frontline healthcare professionals. This is an initiative that we launched October the 10th, which was World Mental Health Day. And it's a digital platform. There's a link again later on, or you can look it up based on what you see right here. But in March, literally in March, before we even went into lockdown, Jessica Edwards, who's on our strategic development team, said, because we're always pitching ideas, what could we do? What could we grow? What could we expand? And this is when it had not crossed our minds yet that we would go into lockdown. Okay. And Jessica said, we're all about who's taking care of the caregivers, always thinking about the family caregivers, right? She said, who's taking care of the people who take care of us? Who's taking care of the healthcare caregivers? Who's taking care of the healthcare professionals? And it was a good question, and we didn't have an answer, but she started bringing that up as she was meeting with partners and sponsors and that kind of thing. And in July, Starbucks asked us the question. They said, who is taking care of the frontline healthcare workers? And we think NAMI should be doing it. So that was in July. They wanted something up and running, and this is Starbucks, so you don't say no to them. They wanted something to launch in the New York City area and the LA area because that's where they had a lot of stores. So we quickly put together a launch initiative. We developed a lot of digital resources. We developed a separate page on the NAMI website that frankly links out to a lot of different places that are already there. Resources for healthcare workers, public safety workers. This is first responders, EMTs, police officers, fire officers, nurses, physicians, emergency specialists. It's for anybody who works in the healthcare space or the public safety space. We talk to them in a way that kind of what the way NAMI does, normalizing that what you're going through is stress on steroids compared to the stress that you typically have. And you've got to stop and take care of yourself. You'll see that we've gotten people to upload stories. We're encouraging them to share their stories with each other, to connect with each other. There are some support groups that are starting to form. The people who got behind this initiative, as Starbucks started talking with us about it, and as our development team started mentioning it in conversations that they have, Thrive Global came on board as a sponsor. There's a program called First Responders First that is based out of the Harvard Public Health School, the Harvard School of Public Health, that is a partner with us completely and totally. We've agreed to share resources. We're sharing their resources on our website. They're referring people from their website over to us. And Kind Bars developed a Heroes Bar that in the month of October, all the proceeds came to NAMI. But here's, that's all exciting. It's all well and good, but something that made it kind of that, regardless of what you believe, that I firmly believe the stars align, however you want to term it, but there are reasons that things happen. There are purposes for things happening. So we were literally working endlessly to get this put together on such a short time frame to make it happen. Again, it's a pandemic. People are in need. You've got sponsors who want it. You've got professionals who need it. Let's get it out there. The week that it was supposed to launch on a Saturday, and we had these care kits that were going to be delivered to, we had 500 of them that had been put together and were being shipped to NAMI New York City Metro, 500 that were being shipped to NAMI Greater LA, that were going to be distributed by volunteers with NAMI LA and NAMI New York City Metro. So we get a call from NAMI New York City Metro, and NAMI New York City is NAMI New York City. They said, we don't have anywhere to put a pallet of 500 care kits. We can't distribute them from our office, and there's a pandemic, and this is New York City, which was on major lockdown. So we were panicking. This is like on Wednesday, and the truck was supposed to be delivering pallets. We got a call literally the same day from a physician at New York Presbyterian Hospital, who was the brother of Dr. Lorna Breen, who was we've been referring to her as the physician who died by suicide. She's not the only one, but she's the physician who received a lot of publicity around her death early in the pandemic, when she went through such a tremendous period of depression after her extensive work hours, and went home to be with her family and died by suicide, Dr. Lorna Breen. Her brother-in-law is also a physician, and he and his wife, Dr. Breen's sister, started a foundation called the Dr. Lorna Breen Heroes Foundation. They reached out to NAMI, ironically, that week, and wanted to partner with us to do something. And we said, well, and they're in New York City at New York Presbyterian Hospital. They said, well, we've got 500 kits in a truck on their way to New York City that we'd like to get distributed on Saturday. This is like on Wednesday. He said, terrific, but can we put a note from our family in each of the kits? And we said, of course. He said, great, because that's Laura's birthday. And it was like, there's a reason we're doing this work. There's a reason that we're in the space that we're in. And that was a long story, but it gets back to the silver lining, if you will, of there have been so many reminders during this pandemic of, at the end of the day, we're all human beings doing the best that we can, and we have to take care of each other. What we've realized through all of this is that at NAMI, we're in it for the long haul. Our mission continues in spite of the pandemic, in spite of the racial injustice and the societal unrest. I'm not even talking about that, not even going anywhere near the election, because when I was in Iowa the last time, they were still trying to figure out what had gone on with all of that polling business that was going on up there. But what we do know is that people need some more support more than ever. I want to kind of give you an update from each of our major teams about what we've been doing, what business as usual has looked like while we were pivoting. And I'm mindful of time as well, because I want to make sure we have time for questions. So our field advancement team, for those of you that may sound like Greek to, our field advancement team, really, it includes the team that does the walk. It includes the team that works directly with the states and the affiliates. So it really is about the capacity building arm of NAMI. I want to say real clearly, because I would bet if I could see Peggy, she'd be clenching her teeth right now. This team was decimated over the last few years, and I don't say that lightly. I started out working for NAMI 15 years ago for this team, and we were a team of a dozen or 15 or so people. And we divvied up the country, and we worked very closely with the field leaders. That team had gotten down to 3 people until about a year and a half ago. One of the good things about Dan Gillison as the CEO, remember I told you guys I'm a huge fan. He came to us from the American Psychiatric Association Foundation. But prior to that, he worked for years with the the National Association of Counties. He knows grassroots. Three big things that I've seen a tremendous change and focus on under his leadership has been our focus on the field, our focus on SMI, and our focus on research. So I want you to hear that, Peggy, specifically. So when I say field advancement, I'm referring to all things related to helping the state organizations and the affiliates get bigger, stronger, and better. So there was an Albertsons grocery store cause marketing campaign that shared revenue with the affiliates in the states. One of the things Dan did early on in his tenure at NAMI during the pandemic was announcing that he was going to decrease NAMI's percentage of the NAMI walk share. He started immediately expanding the field advancement team, starting to rebuild that team. He recognized that there weren't nearly enough people to do what needed to be done. Early on, he made many grants available to states and affiliates to help assist with capacity building at local and state levels. He created a CEO task force, which Peggy sits on. Let me tell you a little bit about this. He had the brainstorm and again, this was COVID. His plan was, when he took the job, that he wanted to visit every state in the first year. He wanted to get the state meetings. He wanted to get to, a teacher training. He wanted to go to some event in every state so that he could meet the people who were NAMI in each of the 50 states. That couldn't happen. So we wanted to come up with a way that he could hear the voices from the field that he may not, you hear about squeaky wheels all the time. We teach about that in some of the NAMI programs. He wanted to identify a group of people that he could meet with on a monthly basis, that he could listen to help inform him about what was working, what wasn't working, what did the priorities need to be. There are 19 people on that task force. Annette Gant, who's the National Director for Field Advancement, and I staff that with him. And again, Peggy is one of the executive directors that sits on it with him. So that part's exciting. What recently just happened, and I've got COVID out beside this, people have been, and I don't say this lightly, people have been very generous with NAMI. Very generous in recognizing that the mental health tail on this pandemic is long and wide. And they're saying, do something. Do something. Dan didn't want to put that money in the bank. He wanted to share it with the states and the affiliates. So he made a $10,000 grant available to each NAMI state organization. And he's made $75,000 available to affiliates. They have to go through an application process, but again, it's a pretty minimal process. Business as usual. There's been an online board training that's been developed. There's a nonprofit leadership lab that's been developed with Joan Gary, who's a national nonprofit leadership expert. She's donating some hours to us. I'm not sure exactly how all this works out, but what I want you to see is there's a real commitment to helping state leaders and affiliate leaders build their capacity so they can help expand the services that are happening in your communities. And the executive director leadership exchange continues. I think plans are happening for that to happen virtually in January. The NAMI walks, listening to Peggy, saying that when I heard that, NAMI walk as you can or walk as you want to, or whatever the term was for the walks this year, I never dreamed that this would be as successful as it is. As Peggy said, they set the audacious goal for what they wanted to raise and that they've gotten as close as they have. It's just, this speaks volumes to the fact that, again, people recognize that we're all human beings. Everybody is struggling, and they recognize that NAMI is somebody that's there to help people who are struggling. So you can't underestimate it. The Information Support and Education Program. This is the team or department. This is the team that does all the NAMI education programs. NAMI Family to Family was launched, the 6th edition was launched this year as an 8-session course. That's continuing. The Spanish and Mandarin translations are planned to be available. They're in development now. They're planning to have those available mid-2021. The In Our Own Voice presenter training and the peer-to-peer class materials have been released in Spanish. There's a NAMI Sharing Your Story with Law Enforcement that's available. So the training is online available now. Christina Bott actually manages that program. I don't know if any of you know Christina or not, but when we had the opportunity to create the NAMI Frontline Wellness Initiative, that really didn't live anywhere at NAMI. It didn't live with the education team. It didn't live with policy. Nobody really wanted to take it. And I was like, that's a great idea. It doesn't live with me either, but it's a great idea. Christina had expertise in it. She volunteered to help with it. So she helped build all of the resources, and she now works on my team. So the Sharing Your Story with Law Enforcement sits with us. Accessing the education online training, the NAMINet page. So you can go to NAMINet, which for those of you who are education people or who are involved in any of the programs, that's the page where teachers and facilitators and trainers can go to get resources, and you can get the latest guides on how to do programming virtually there. And as always, there's an email address there at the bottom, namieducation@nami.org, that if you have any questions about programs at all, you can reach out to that address. And these slides are going to be available later. I'm going to share them with Nina after the presentation so she can share them with you. The helpline also lives with the Information Support and Education team. So I just wanted to share some numbers with you quickly, and I'm looking at the clock, Nina, so I know I need to wrap up shortly. The blue numbers represent this year, and the orange numbers represent 2019. Okay. So I just want you to look at this is comparing numbers in April. Look at June, and you look at July. In August, we saw a 75% increase in calls that we received August this year versus August last year. No surprises here. One of the things that the pandemic has done, which again, silver linings, is allowed us, because we're now able to take calls virtually, which we talked about for years, developing the capacity to do that. But one of the things one of the gifts that it's given us is that we can now have volunteers across the country. We're not limited to just volunteers in the Arlington area. So that's been super helpful. What are people calling about? One of the questions we ask people when they call is, what is the primary, can you tell us the primary diagnosis that you're concerned about, or that the person you're calling is concerned about? What I want you to notice, and I don't have a pointer, but if you can see my mouse, every year since we've been tracking data, schizophrenia has been number one. It's been schizophrenia, it's been bipolar disorder, it's been depression, and anxiety has been number 4 every year. And look at 2020. Anxiety is above and beyond. So again, no surprises there, right? The data proves it out. This is a tiny slide. The biggest thing is it's showing that the main reason people call, again, orange numbers being 2019. 2019, the main reasons people were calling were about treatment. This year, the main reason people are calling is about support. Okay. So again, just giving you an idea of what we're seeing. So what about the policy team? This is by no means all that the policy team did. Angela Kimball would be mortified if she thought I was painting a picture that this is all they did. But this was certainly the 2 big things that happened in policy this year for their team. They spent a lot of this year focusing on activating people to vote, to be aware of what was going on, to ask questions, to encourage people to get out and vote, to be involved, and the 988 legislation. Getting that passed was huge. You'll see that pop up again in a minute when I talk about what we've got coming in 2021. Research. Okay, why am I showing you a whole table of organization? Because I'm the one doing the presentation and this is my team. That's why. And this is brand new. Up until March, remember, Dan started in January. We went on lockdown March 20th. Sometime in March before the lockdown, Ken Duckworth was medical director. I can't remember what my title was, but we both worked in the information support and education team. One of the first things that Dan Gillison did was pull both of us out of that team, and he created the research and quality assurance team, which is staffed as you see it there. And he named Dr. Duckworth the chief medical officer. And just in September, we hired an associate medical officer, Dr. Christine Crawford. There's no line to them because they're really, they both report to Dan, but everything that our research team does is in collaboration with them. What I wanted you to see, again, remember I said that Dan has a focus, field, research, SMI. I wanted you to see this. This is a team that didn't even exist until March. AMP schizophrenia. If you've never heard of this, and Nina, please send me a, oh, you can see my mouse. Good, I just saw that. I was looking for a message if you told me that you needed me to speed up. Tell me when I'm out of time and we will absolutely stop. I'm trying to go through this quickly.
You're good, Teri. I'll send you a text to remind you in a couple minutes.
Thank you, ma'am. AMP schizophrenia is a major, huge deal. Again, I'll try not to go into details, but I get super excited about it. This launched in August. The short story is accelerating medicines partnerships or public-private partnerships where the federal government puts up a chunk of money and pharmaceutical companies put up money and other private partners put up money, and they agree for the researchers to work together, share data, tackle tough problems. In 2014, they developed these, for the first time, they developed these partnerships to look at lupus, diabetes, rheumatoid arthritis, and Parkinson's disease. Schizophrenia was one of the diseases they considered looking at. They didn't. And NAMI kind of had a little fit about it. It's like, why not? What's more complicated than schizophrenia? So in 2016, we partnered with the Stanley Center for Psychiatric Research and started meeting once a year with researchers to try to light a fire under the federal government to do something about it. And in August of this year, it's missing the 2020 bullet, but in August of this year, the AMP schizophrenia launched. It's a $1 million project for 5 years where we have 10, I'm looking at the partners, Janssen, Boehringer Ingelheim, Otska, NAMI, One Mind, the APA, Wellcome Partners, all ponied up. NAMI sits on the steering committee. Carlos Larari, who is on our national board, who lives with schizophrenia, is NAMI steering committee member. This is a huge deal. This is big brains in science, all working together, sharing data, not fighting over who's going to publish first, almost like looking at for a vaccine for COVID, almost, but not quite, but focusing their energies to look for genetic biomarkers to help us figure out how do we identify clinical high risk earlier so that we can do treatment earlier. Other things in research, we're partnering with a bunch of people doing a bunch of things. Again, Dan is interested in us doing this. People have reached out to NAMI for years and wanted us to partner with them, helping inform research studies, not just recruiting subjects, but helping them understand what families and what individuals need to know about research to be engaged, and what they need to know what they want to know about the outcomes. The two at the bottom should be at the top. We had 2 research studies published this year. one by your Iowans there. The pilot research on the NAMI provider program at DMU was published this summer. Yay, huge shout out to them for getting that done. And the research study on the NAMI in Our Own Voice program was published this year as well. I want to show you this one quickly, and then I'll promise I'll click through the rest of them fast. This is pretty big. This is earned media share, and this is from September. I don't have the numbers from October, so apologize. This was the last slide I had from our Marcom team. What this pie chart means, this is, and they look at this through Google Analytics, but this is of all the people who were looking for information on mental illness and mental health. 38% of them come to NAMI. 32% of them come to the Psychological Association. 21% go to the American Psychiatric Association. 9% go to MHA. That's huge. That's huge. These are some of the folks that reached out to us in September just to see what we thought. These are people that I don't know, but they know NAMI and people know them. Again, folks realize that at the end of the day, we're all human and they want to be involved with what we're doing. This is NAMICon registration. Our new advocate came out. I have not gotten mine in the mail yet. Not sure if you've gotten yours yet. You can download it. So if you haven't gotten your hard copy yet, but it's got phenomenal content in it. There's an ad on the back of it about the Great American Smokeout. And we launched, which was just yesterday, but we launched some new materials on smoking cessation because of the huge impact that has on people with mental illness, and we die way too early. So looking forward, I'm going to go through these quickly. Just this week on Monday, we had a new Chief Strategy and Operations Officer start, Sherman Gillums. He's going to be my boss. I'm meeting with him after this meeting, actually. So I'm going to be dressed up. He's going to think it's for him, and I'm going to let him think that. So we're excited about having him here. Actually, I'll be reporting to him, our Policy National Director, our Education National Director, Field Advancement National Director, and Diversity, Equity, and Inclusion National Director will report to him. So we're super excited. He has a phenomenal background. He comes to us from the Disabled Veterans Association, and he's been a phenomenal leader in a variety of different roles. So we're super excited about him. We're going to be expanding the NAMI helpline hours to try to accommodate some of our West Coast callers. I believe they're planning to add 2 for sure, maybe 3 hours, and they're planning to do that in January. Also planning to add a chat feature to the helpline beginning in January. The education team is developing a NAMI Homefront on Demand that will launch probably by the end of next year. They didn't give me a specific date on it. Again, I mentioned the CEO task force. That's going to continue. People may rotate off after a year, but that's something I firmly believe Dan is going to keep in place to inform him and the board of directors. There will be an update and a relaunch of NAMI Hearts and Minds. If any of you remember that, that was it wasn't a program that you had to be trained for. It was an informational booklet. It had videos that went with it, but it was all about overall physical health. There was a cardiovascular section. There was an exercise section. There was a smoking section, but it was built around, we say there's no health without mental health, but your mental health can't be the best it's going to be without physical health either. And Ken and I are committed to updating that curriculum next year and getting that material out to people. And again, that's not something you'll have to be trained for. The materials it'll be turnkey. It'll be things you can just download and use. We'll be launching a national mood disorder survey in the second quarter of 2021. NAMI did a national depression survey in 2009. We're going to revisit that. It'll have a component for people with depression and bipolar disorder, their family members, and then one for the general public, just looking at how attitudes have changed and how experiences have changed. But also we'll have some COVID related questions on it, how the pandemic has affected it. We'll be launching a field assessment of NAMI FaithNet in the first quarter. Our research team is going to be working with the field development team to do something similar to what we did with NAMI on campus, interviewing field leaders. What's out there? What are you doing? What's working? What should NAMI's presence in this space look like? Again, that's a big interest of Dan's, and that's something that had kind of shriveled on the vine over the last couple of years, and he's very interested in us re-energizing it. But 988 implementation, that's going to be huge for next year. Letting the field know about models of care, seeing what's up with the new administration, and monitoring challenges of the CARES Act. Here are some links for follow-up. Again, you're going to have this deck. What's one thing that won't change? NAMI. You're not alone. We're here. We may look a little different. We may be virtual. We can only hug you through the video camera, but we don't change. We're still here. And Nina, we can take questions now. And if you ask me questions I can't answer, I promise I won't make something up. I'll either get back to you or I'll tell you to email me, and I will connect you to the person you need to talk to. And I'm going to unshare my screen so I can look at you guys. There we go.
Perfect. Thank you, Teri. So the first question that we have, the person says they love the focus on serious mental illness and goals focused on actually improving treatment and decriminalization of people living with serious brain disorders. Would you agree that increasing reimbursement rates would be helpful for increasing the mental health workforce, agencies, and beds? What are some thoughts on that you have?
Yes, and amen are my immediate thoughts. Before coming to NAMI 15 years ago, I know I look like I'm only 21, but I'm a little older than that. I worked in community mental health centers for 20 years. And I will tell you, the reimbursement rates are a huge, huge challenge for the providers, for the organizations, as well as attracting people to come into the field. It keeps salaries down. There was a projection, and this was pre-pandemic. So it's been over a year, and don't ask me to even, I'll be lying if you ask me to quote it. I can't remember who even did the study, but there's a shortage of psychiatrists now, but the projection was that by 2050, the shortage will be much worse than it even is now. We've got to do something to recruit people to come into the field. And part of that is equity of payment for the services.
Awesome. Thank you, Teri. Another question for you is, what is your advice for local NAMI affiliates about the most important things that we can do to build our organization's strength and reach in the year ahead?
Gosh. It's hard to put your finger on just one thing. If there's anything that this year has taught me, it's underscored the need to not lose touch with your base, not losing touch with who you are and what you do, and not trying to expand too quickly. I think there's been a lot about this pandemic, so I don't know how much of it is the pandemic and how much of it is Dan's leadership, but there's been kind of a confluence of things this year that have brought us back to our core. It's forced us to reassess what's really important and what's at our heart, and then communicating that out to the people that are involved and helping them feel engaged. And so again, I'm kind of, I'm talking to myself, so I apologize for that, but I think it also applies at the affiliate level. It's making sure that that you hear what the people in your community and that are involved with you and your affiliate want to do, want to be involved in, that they understand where you and your board want to go. If there's not agreement, that you figure out how to meet in the middle and kind of challenge and support, challenge behind closed doors, figure out where you're going to go, and then support each other as you move forward. because we've got way too much work to do to divide, if that makes sense. And I've really felt that. I hadn't put it into words, so thank you for that question. That's what I felt this year with us at National. This whole pandemic thing and being virtual, you know, we're not all flying around. We've had time to actually focus and meet and talk about what really matters and who are we really at the end of the day. And then people coming to us, like the people around the frontline wellness. Starbucks said somebody needs to do this, and I think NAMI is the somebody.
I love that. Yes. So another question for you. Are there plans or initiatives being put in place to create more mental health clinics and urgent care to help lower the needs of individuals experience mental health crisis from just going to the ER? The person is a nurse and have seen firsthand how poor the treatment can be in the ER with little education on their end and long waits.
I will tell you that is something that NAMI advocates for in a variety of ways on a regular basis. Our policy team does at the federal level. I sit on the Coalition for Psychiatric Emergencies that's connected to the emergency physicians group. And ironically, that group formed, that coalition formed because emergency departments didn't want to board patients. They were tired of holding people. And NAMI's thing was, great, we don't want you to hold us either. We want you to do something. Help us, you know. So is there a plan to do something? Not that I'm aware of. We're going to continue to advocate for it. What we see, part of what we see our role in the implementation of the 988 legislation is sharing out, and we were talking just yesterday about using the Ask the Expert series as a way to bring in experts on different crisis models to present that so that we can put out there what are the models that work, so that people in Mississippi and people in Iowa don't have to reinvent the wheel and can't sit back and say, oh, we can't possibly do that. You can say, oh, yes, you can, because they're doing it in Arizona and it works. So our role is to share out the people that are doing it that works, to try to get people to make those plans.
And Teri, if I could jump in for Iowa, we passed legislation 2.5 years ago about serving people with complex needs. And there's a series of new programs and services that are to be coming online. The first is access centers, which probably a lot of you have heard of. Access centers are really based on the San Antonio model, which is what Teri was speaking about, that's happening in Arizona. It's a take all comers, 24/7, no eject, no reject kind of service and facility. And a handful have opened. There have been some issues in actually making them work and be what we had envisioned for access centers. But I know that access centers are planned to open within the next few months in both Iowa City and Cedar Rapids. And we're excited to see that roll out. And we're supposed to have 6 by July 1 of next year. We're hoping that happens to take some of the burden off of hospital emergency departments, because that was the goal.
That's terrific.
If any of you, and there's other things in development. So if any of you are interested in learning more about that, and also our fight to get them funded completely at the state level, join our grassroots advocacy list and you'll get regular updates and you'll learn more about the efforts around this.
That's terrific.
All right, well, we are at time. So I just want to say a huge thank you to you, Teri. You couldn't tell, but I was laughing throughout the presentation. I love your energy, love your spirit, and just thank you for being here today.
Well, you're most welcome. I'll share my slides, and if you look at the notes on my slides, you'll notice I didn't follow any of them, so don't pay attention to those. I never do. But thank you guys for having me, and just trust me when I say it. You have such a phenomenal staff and board with NAMI Iowa, and just such an energetic group of people. And I wish I was there with all of you in person. I will be again. And look forward to a great conference day. Have a great
Teri, we have 316 people online.
I just looked while you were talking. I looked because I wouldn't let myself during the presentation, so I just looked. So great job.
And you are an honorary Iowan, so
thank you.
Yeah, you're welcome anytime.
And I did check the weather last night, by the way, just so I'd know whether to wear my snow boots in here, because I did want to look I wanted to look appropriate.
Teri loves it when she comes and we have snow. Yeah. Thank you.
Have a great one, you guys.
Thank you,
Bye.
Teri.
Bye.
So that's wraps up our first plenary session. And we are going to take a little bit of a break. We're right on time. It's 9:40. Our next session with Kelly Garcia will start at 9:50 promptly. So take a break, take a stretch, and come back to join us in 10 minutes.